You to another Facebook and YouTube Live. It is so good to be with you here, coming from the Twin Cities here in Minnesota. It's been a beautiful spring day. The snow is finally melted. It's above freezing, and the grass is even green here in Minnesota. So it's a pleasure to be with you today. And if you're checking this out for the first time, the goal of this live stream is to support and serve the needs of everyday educators such as yourself, to empower you with practical strategies to better prepare your students for both practice and licensure. And my name is Keith, if we haven't met, and I'm the founder of Keith RN. And you know, the why of what I do with Keith RN is to be an innovator and to lead the changes that are needed to radically transform nursing education, to develop the clinical judgment your students need for both safe practice and licensure. And so really my goal is just to partner with educators, creating the tools, the resources that, as well as the strategies to empower you to make a difference and to, again, put clinical practice first in nursing education. Sometimes we lose sight. The NCLEX muddies the waters sometimes, and we've got to pass the NCLEX. But let's remember that despite the challenges that we have in nursing education, including the next gen coming, that real world practice and the realities of practice need to be the focus. And we can do both when we emphasize the best practice strategies of clinical reasoning, contextualizing our content, which leads to the outcome of clinical judgment. And so I'd like to know who's out there tonight, and just want to just kind of give you a shout out and let me know where you're from, what state you're coming from. It's a blessing just to show up here in my home office and see educators from around the country, from coast to coast, who's ever able to be here. And if you're here today, I just want to thank you for taking time out of your schedule to join me tonight. And just really, it's not about me. It's about having a dialogue that we can strengthen and transform nursing education together. We can't do it alone. I can't do it alone. And we need each other to be a part of that needed change. And so just want to shout out Shannon, coming from California, where I bet you it's warmer here, Shannon, than it is in Minnesota. And Carol is back from South Carolina. Great to see you there. Cindy Hudson in Chicago. And, and Shannon, your new faculty. And so awesome to have you here. And so sorry to hear about the strike. I know that's a challenge. And Lisa in Kansas City, and Susan, I know who you are. Good to have you from the East Coast in Providence, Rhode Island, and Jennifer in Maine, and Terry in Arkansas, Carol again. And yeah, thank you, Carol, for the book release. We'll talk about that in a little bit. But I've been really busy. I was in Minot, North Dakota about 3 weeks ago, and at a conference there for both students and nurse educators. I drove there, came back. The next day, went to ATI and the ATI Summit as a vendor for Keith RN. And so I've got my hoodie from Seattle, Washington. It was a beautiful city, and ATI always does a first-class conference. Was a pleasure to be there. And, one of the highlights that I had at that conference, besides meeting so many educators, if you were at the summit, put a shout out, put what you took away from that wonderful conference. But, for me, the highlight for me was seeing Dr. Patricia Benner in person. She spoke and shared her work. In fact, I have the book right here, and she signed it for me like 8 years ago at Elsevier in 2013, Educating Nurses, a call for radical transformation. And this book rocked my world as a new educator, gave me permission to do things differently. And Dr. Bender had a chance just to reconnect with her, say hello, and again, just to see her personally, as well as present her work from Educating Nurses, where she talked about the paradigm shifts. And if you're not familiar with them, get the book. But really, the three that really stood out to me that are really essential to bring about needed change in nursing education. It's really simple, and it's the basis really of all that I do with Keith RN by operationalizing and making practical Pat Benner and her co-author strategies and their research findings from the Carnegie Foundation back in 2010. Really simple. Number one, contextualize the content. Don't just teach the textbook, contextualize everything you teach to the bedside. Second, bring clinical and classroom together. Don't have them in separate silos like they tend to be in nursing education. And third, emphasize the thinking and action skill of clinical reasoning, which takes place in the clinical setting as we apply the knowledge from our classrooms and then think in action and reason as a situation changes. And so Dr. Benner is one of my heroes, probably the most influential of my journey as an educator. And so just basically, just a pleasure to see her and meet her there. And I also want to share an article that Dr. Benner recently wrote. Actually, it was an interview, to be honest with you. It was an interview that is online. Dr. Benner is now at the University of Nevada, Las Vegas. And she's faculty there, and you can read all about kind of her journey as she is now moved from San Francisco to Las Vegas, where they're blessed to have her. But this article is about articulating better nursing practices. And what Dr. Benner talks about in this article, I want to encourage every one of you who are attending this to really check that out, because what Dr. Benner is talking about is that there's two types of knowledge that we really need to develop holistic clinical judgment, or develop the robust knowledge that our new students need for practice. The first is textbook, which is really what we do really well with in nursing education, sometimes too well, because we have TMI and infobesity. So we've got to cut it down. But we got lots of knowledge, lots of information that's decontextualized from practice. But Dr. Benner talks about exclusively in this article about the knowledge that's embedded in practice, that there is no substitute for the knowledge and the nuanced thinking that a student needs to develop in clinical, as well as a nurse acquires with clinical experience. And for me, as I looked at my journey as a nurse of 36 years, and many of you who've got your years of experience, you have this knowledge of practice. And we need to be sure that we're bringing that knowledge of practice, that you're bringing your stories, you're bringing your examples where you saw a subtle change that made a difference. What about the diaphoresis, the sweat that signifies sympathetic nervous system stimulation? Why is it there? What could it signify? Those are the pearls of practice that every one of you need to bring, that your students don't just need your textbook knowledge, they need your knowledge that's embedded in practice. And what really kind of stood out to me with this article is that when I wrote this textbook about 7 years ago, the second edition called Think Like a Nurse, Practical Prep for Professional Practice, what I recognized back then was the importance of having students understand what is most important to practice, and to share the best that I could the pearls of clinical practice that I've acquired, and that other contributors also who contributed also learned in their journey, to share them with the next generation. And so as I've now completed and have just made final the third edition, which is really a complete rewrite, I'll be talking about that more. But what I'll be talking about tonight is coming from the second edition of building the knowledge base for professional practice. We'll be talking about pharmacology, fluids and electrolytes, and highlight the things that I've been sharing for the last several years to educators all across the country in my workshops, just briefly, as well as just kind of go into some of the practical strategies that you can use to bring that Pharm knowledge of practice alive, to bring then the fluids and electrolytes and lab value knowledge alive to your students. And this resource is a 3-volume set that, again, just went public with that. Just finally got all my books back from the printer, and am now able to basically make it available. And I'll share just the link that you can go to if you'd like to learn more information and take a look at that while we're talking. And so again, just thank you again for all these. Kim is here tonight, and Alan. Great to have so many of you here with us tonight. So let's get started. And what I do want to share before I get started is that these Facebook Lives don't just live and die on Facebook and YouTube Live. That actually these live on 2 different media platforms that you can access anytime. And so if you found this content helpful, I want you to be aware that you can go to two different platforms. And I'll just pop them in here. I have my YouTube channel, Think Like a Nurse. This is being streamed live on YouTube. I've got over 100 YouTube videos, prior Facebook Lives, as well as some of my shorter videos as well. The benefit, that's an easy to access, but the other Facebook group is my Facebook page, Think Like a Nurse. And on that, on the video link, the benefit of watching a prior Facebook Live and all the work that we've done over the last 3 years of these Facebook Lives, you have the chat, you have the links. YouTube, you don't get the links and the things that I share and what other people contribute. And so if you really want to get the robust experience of getting those links and background information, go to my Facebook page, like the page, because then you'll be in the loop whenever I go live, and usually every 2 weeks, every other Thursday. And so just be sure to check that out, and just basically share the link. If you find the things that I share helpful, you know what? I don't want this to live in a Keith RN silo. You know what? I want to get it out there, and every one of you can be part of that needed change to transmit some of this information that we so desperately need to strengthen all that we do in nursing education. And so let's start with pharmacology. Let's talk about, I'd like to know, what are your struggles when it comes to teaching pharmacology in your classroom or in your clinical setting? And so I'm going to wait just for a little bit. So I want you to share your struggles, your challenges with pharmacology. But while you're doing that, I'm going to share a simple strategy that we need to incorporate to help strengthen how we teach pharmacology. When we look at pharmacology, how many know that there are too many medications? There are over 5,000 medications in your nursing drug handbook. And did you know that there's over 1,000 pages in your typical drug handbook as well? There's TMI. And one of the things that we need to do to help our students get a grasp of pharmacology is that, remember this, less is more. Deep knowledge of what is most important is going to help your students retain and transfer knowledge from one semester, from one clinical to the next, to the next. And so what I want to encourage you as an educator to do is identify the top 10 medications, the most commonly used medications in your clinical setting, and identify what those are at the fundamental clinical, at the basic med surg, at the advanced med surg, at the specialty areas, at the capstone. 10 to 15 of the top 10. Now, this is the thing I'd love to see you as educators do in your programs. Scaffold it. So let's basically, if you identify top 10 of fundamentals in the skilled care setting, when it comes to basic med surg, your next top 10 do not repeat. They basically build on those top 10. So by the time that your students graduate, they basically are able to have about 75 to no more than 100 medications, as well as the Pharm classes they belong to help them translate this knowledge to practice. Because when it's repeated and it's a small bite, again, pharmacology, we got 2+ years if we're in an ADN or BSN program. LPNs, we got a shorter time frame. But again, bite by bite, it's kind of like how you eat an elephant. The same is true with pharmacology. So I want to encourage you as an educator to shrink down the scope and help your students identify those 10 most commonly used medications in your setting before the first clinical, so they can come relatively prepared with basic information of what's most important in that context. And so let's take a look at some of the questions here. Shannon's kind of, Shannon, you stole my thunder. So many meds. It's kind of like, you're absolutely right. And the thing that's really important to know, Shannon, and as well for every educator and nurse in practice, you don't need to know everyone. Pharm classes is a very practical way to streamline and funnel the knowledge of pharmacology. But again, providers are creatures of habit, and there are the most commonly used medications that we see most consistently in certain settings. So again, look it up, but we should empower our students to have a foundation of knowledge that is basic, and we'll talk about what that looks like. Tanya says this, trying to find the need here. I can put it up there so we can all see it. trying to find the need to know classifications and what we want them to learn. And so, Tanya, I'm going to lead into that very shortly and ask kind of the question. I'll ask it early and you all can think about it. What is the most important content in your drug handbook that your students must know and understand to be safe in practice? And so what I'm referring to is really simply, if you look at David's Drug or any other handbook, has Pharm class, indications, mech of action, pharmacokinetics, contraindications, side effects, interactions, route dosage, dosing implications, and education teaching. So which one of those is most important, Tanya? As you look at that, because what we have to do as educators is help our students focus on those aspects of what is most important to practice and the knowledge for practice to be safe. Let me look at some of these other questions here. So we're going to get back to that, Tanya, in just a moment. So stay with me there. Students have said we don't need to know it. We can look it up in a book. And Brittany, that is not a good answer because there's way too many medications. You can't look up everything. Every time you give something, you'll never remember it. We have to expect, I believe it's important that we need to expect our students to have a baseline knowledge, minimal, I wouldn't say minimal, but in essence, foundational information about the most commonly used medications, because that's what they're going to see most often in practice. Belinda says this: students who are disengaged from the content. I don't know what that means, Belinda. If you could clarify that, are they just kind of like not engaged in the clinical setting? Alicia asked this question: how hard to determine which is the must-know information? Okay, we're going to get to that, Alice. We're going to remove the splinter from your brain on that topic here in just a moment. And Jenna says beta blockers, calcium channel blockers, and then, okay, all the different Pharm classes. I got you. And then getting into all the different IV fluids and antibiotic classes. Okay. And again, take them a bite at a time. And Shannon says this: when not to give, and good luck when you're giving 15 medications for 6 patients. You're right. So, you can't look up everything. So this is the $1 million question, and I want to hear it from you first as educators who are attending this. Of those categories in a drug handbook, Pharm class, indications, mech of action, side effects, interactions, route dosage, what's the most important? I'm an ER nurse in practice. I love ER. But the thing you learn in ER is the importance of triage, priority setting. What is the one thing you need to do right now with your patient? And I would like to apply the principle of triage to pharmacology and the drug handbook. So let's do 2 things with Pharm to keep it really simple. Let's narrow the funnel to the top 10 to 15 medications. Expect our students to have a baseline knowledge of what's most important. This will set them up for practice. This will also set them up for NCLEX success as well. And so I'm waiting for some responses. Is anyone going to be bold and talk about what are those aspects as it relates to pharmacology? And I don't see it yet, but I will wait just a moment. But when it comes right down to it, and you're right, that information about when to hold, when not to hold, Shannon, is so true, Jennifer. But the question is this: what content do we want our students to know? Now, allergies are important. I agree, Kim. But if there's one, once we've just done that simple check, I'm going to make a statement that I think, see what you think. Of all the information in the drug handbook, it is the mechanism of action that must be simply understood, not memorized by your students. Because when a student understands the mechanism of action of the Pharm class, for example, of a beta blocker, they're able to translate that knowledge and are able to basically anticipate what are the most common side effects of a beta blocker. What are the nursing assessments that are required when you give a beta blocker? When a student or a nurse in practice simply understands, not memorize, there's a difference between memorizing and understanding. We must emphasize understanding, because when I would ask my students, even my advanced students in clinical, they'd be giving a Tetalol. Ask them, tell me about a Tetalol. Oh, it's a beta blocker. And I'd say, good, that's a Pharm class. Tell me this. What is a beta blocker blocking? And I would kind of get that Minnesotan deer in the headlights look for a few seconds. Let them think. Don't interrupt your students. Make them think. It takes 15 seconds for them to process. Give them time. But then ask a leading question. Is it blocking sympathetic or parasympathetic nervous system stimulation? And they'll remember something from pathophysiology, that beta and sympathetic somehow go together, and they do. So if the student begins to understand that a beta blocker is just simply blocking beta receptors that receive sympathetic nervous system stimulation on the heart and sometimes the lungs, what's that going to do? Well, it's going to block it, going to lower the heart rate, lower the blood pressure. What should I check before I administer? Maybe their heart rate and blood pressure. What are the side effects? Well, you can get too much beta. Too much beta blocker, I should say, too much blockage, and that can cause bradycardia, hypotension, orthostatic hypotension. That's the level of knowledge that we want our students to be able to possess in our clinical setting. And, as we're getting back into the clinical setting, as many of you are clinical instructors, are you holding your students to that simple standard of understanding and making sure that they understand in one sentence the mechanism of action? And I hear there's a lot of, and Jennifer, that's right, and Jennifer, excuse me, pathophysiology. I've said it before, and I'll say it again. It is the golden thread of the applied sciences that must be understood to develop the critical thinking that our students need for practice and licensure. If they don't understand and apply patho very simply, we don't have to recite textbooks as nurses in practice, but we do need to know what a beta receptors are. We need to know about ACE inhibitors and that whole renin, angiotensin 1 and 2. Again, basic, but not at a textbook level. That's the knowledge our students need. And so again, let's hold our students to that level of knowledge in our clinical setting. So great. I'm glad to see that all of you guys are getting excited. Wherever you're from, that's a blessing to me, and I'm thankful for your thoughts. And Cindy asked the question here. I'll just throw it out there. What are your thoughts about teaching patho with Pharm or as two separate courses? That's kind of a curricular decision, Cindy, but what I would say is this. Patho and Pharm go hand in hand. And really, pharmacology, if you really want to think about it, is just applied pathophysiology to practice to medications, which is the foundation of really one of the most important skills our students need to do besides clinical judgment. They need to be able to, again, understand the mech of action. So Cindy, I would kind of say that they belong together because they are integrated and have that relationship, because the mechanism of action is the foundation of pharmacology. When that's understood and applied, and you need to know your patho to make sense of what's an ACE inhibitor inhibiting, what's a calcium channel blocker blocking, etc. And so again, that's so foundational. And Nicole has a great comment here. She says this: I tell my students, if you understand the pathophys of disease, you can easily apply the mech of action of the medication in that body. And so, Nicole, you're a patho hound just like myself. And I think that, we recognize as experienced nurses the foundation of pathophysiology to real world practice. And again, our students struggle with it. When I spoke at the Minot, North Dakota conference, I saw maybe 5 hands out of 200 students who really, excuse me, just battling a cold from Seattle and coming back a week ago. But we're going to get through this. But only 5 really enjoyed, or really valued and enjoyed pathophysiology. So it's a difficult science. I think as educators, if we're brutally honest, we struggle with it too. And so it's kind of like we need to do like we do with the NCLEX, that mantra, is basically the essence of taking what's a weakness and make it your strength. We need to do that with our students. And let's just be humble enough as educators to recognize our limitations. I really had to, I was a very average nursing student, but I really applied myself to understand pathophysiology, and it made me a really good nurse. Let's do the same thing with our students and with practice. And so anyways, just some thoughts to consider there. And so as we look at Pharm, that's really what I wanted to kind of to highlight, as well as just talking about, the labs that are essential to pharmacology with excretion, and when our students understand the importance of anything that goes in needs to come out, needs to be excreted. When our students understand the importance of creatinine as a gold standard of renal function, as well as liver function, that your AST, ALTs are the foundational liver labs that really tell you how the liver is functioning. And so if we are administering any medications, because every medication is usually broken down by the liver and metabolized and excreted by the kidneys, that's another reason why the creatinine and the ALT, AST in a liver profile are always relevant, even if they're normal. Because again, if they're abnormal, if that creat is high or the ALT, ASTs are high, what does that tell us about their liver and kidney function and about their ability to metabolize? And I've seen rapid responses where the patient got too much opiates with a history of liver and kidney disease, couldn't excrete it, and therefore was obtunded, lethargic, had to give Narcan, and saw an improvement. So again, that's the knowledge of practice that we need to bring to our students. And so what I want to share with you here, just in a moment here, is just to kind of show you one of the resources that, let me just go right, just one moment here. There we go. Sorry with my voice. That's just been, I'm just having a hard time here. What I wanted to share is that, when you look at the 5 foundational questions, I want to kind of close out pharmacology with this. And this is from my chapter in the volumes, in the 2nd volume of the new Think Like a Nurse, Building the Knowledge Base for Practice. But these are 5 questions that, again, I kind of expound upon and talk about in the book. But the very first one is, what is the drug for? Why is your patient receiving it? I think most of us ask that. But my second question gets right down to the dirty. What is the mechanism of action? In your own words, because I want to make sure my students understand it. And then we need to talk about what's the expected patient response to a beta blocker. One of the next gen questions that's also a practice question is this response expected or unexpected? That's a clinical reasoning question. So when we ask this question in clinical, in classroom, when we're teaching and bringing context to our content with case studies and other principles, that expected patient response of a beta blocker, what should it do? Lower heart rate, lower blood pressure. What if it doesn't? That's a problem. What assessment data do you need to review before giving? Looking at the labs, vital signs, what are the red flags of relevant data? And finally, what is a safe dose for this medication? And again, this tells you the assessment data as well as safe dose. Is it safe to give? So many of you are asking that. And so these are the questions that I kind of reflected upon in my practice in ER-ICU and cardiac telemetry and et cetera in my years of practice. But I think it's really important for our students to have that as well. I just kind of want to show you what I do with the textbook as I explain these questions. I have numerous icons and key takeaways that, in essence, kind of put a little exclamation point. I don't want to just have a lot of blah, blah, blah. I want to help students to see what's really important, as well as a lot of pause and reflection. How did you do with this information of like answering these questions? What's a calcium channel blocking? How'd you do with that? So again, having students engage with this information and again, identifying those takeaways, reflections. But then what I also did for students, it's also a helpful tool for educators. I have my must-know medications. I surveyed educators around the country, different areas. I got about 70 medications that are in essence, and I also broke them down by pharm class and most common meds in that pharm class of the most commonly used medications for cardiovascular, for blood anticoagulants, urinary drugs, the respiratory, the pancreas, diabetes, GI, the pain, neuro, anti-infectives, antidepressants, etc. And so helping my students, and again, help you as an educator, what are those that we can focus on? And so what I wanted to share with you here is just some of the strategies that I've done that we can basically kind of make pharm practical with our content. And so one of the things that every time in clinical, our students have got, our patients have got a past medical history as well as home medications. Well, you can create a simple chart. I've also got a worksheet of this in the appendix of the book of, again, of a blank one that you can use and make copies of. But again, what's their past medical history? What are their home medications? Connect the dots of what's treating COPD, which one's treating hypertension. Then identifying really simply the pharm class of each medication of your patient and the expected outcome. What's it going to do to benefit them? And again, this knowledge will help them kind of see the recognition, pattern recognition, or relationships of clinical data is, again, another clinical reasoning skill. I also have another worksheet where I kind of take the pharm classes, where you can essentially identify like the ACE inhibitors. What is the mechanism of action of that pharm class? Identify the different generic drugs in that pharm class. What's the route as well as the dose range? And again, in one very simple table, we can simplify the knowledge of pharmacology by understanding which ones are ACE inhibitors, because basically an ACE inhibitor beta blocker, the mechanism of action is the same, whether it's atenolol, metoprolol, labetalol, minor differences, but minimal for most of those different drugs in a pharm class. So again, pharm classes is a really effective way to chunk pharmacology knowledge. And I'd encourage you, to consider that if you're not doing that already. But then this is one of the worksheets that I developed years ago for my students. And I have a blank version at the end of the appendix. But this is really kind of what my students, I think, really helps them to see the domino effect. You have the medication you're going to be administering. Let's say it's one of your top 10. You want to know dose range, pharm class. Why is your patient receiving? The mechanism of action, and then these follow the knowledge of the mechanism of action, the expected side effects, as well as the assessments and nursing responsibilities. When the mechanism of action is known, that's the domino of side effects and assessments to administer safely. So again, the question that I asked and that many of you acknowledge, well, what's most important? I hope it's clear to you. Mechanism of action is going to help your students put that all together. And so I just, as we look at pharmacology, I'm going to talk a little bit about lab values, but I'd love to know what questions you have here in the chat. So let me just, I was sharing my screen for a few minutes. And so, yes, be hungry to find out the why. Don, I love that because, we've got to encourage curiosity, not spoon feeding. Our students are stressed and they just want to be told the answers, and many of them just don't want to do the work. But we want to encourage that love for learning, that curiosity. So, man, thank you for sharing that, Don. I totally agree. And, be like detectives. I totally agree with that, Nicole. Great insight. Asking why. What I loved working about in ER practice, I had physicians and PAs right there. And I could ask them any of my questions like, why is this drug this? Why did you order that? What was your thinking with this? And I learned so much by just being curious. If I had no interest to learn, I'd be a very average nurse. It's the nurse that wants to know the why that really is going to be exceptional. Let's encourage that hunger and that thirst of knowledge. And so just a heads up. And Nicole says she can't wait to get my books. Thank you. And she was in Minot. Yes, she got them before anybody else did because I had them hot off my garage floor before they went public. So I hope she finds them helpful. And yes, be initiators, loving it. And connecting the dots. What I think we need to help our students do in clinical with pharmacology, making those connections. They need your guidance. They can't do it on their own. They need a guide on the side. And that's where you and your knowledge embedded in practice, because you have that knowledge. Your students need it. And so don't expect them to know it. Sometimes our expectations can be too high as a nurse educator. No, like a parent, I had 5 kids and I tended to have my expectations sometimes unrealistic. And I learned really quickly, I had to lower them to what was realistic for what they could do. Same thing with our students. And so again, just basically want to share that. And Jenna, thanks for sharing that. Yeah, your mom I was in Seattle and she got one of your books and signed it for me. Yes, well, put it to use, Jenna, and I look forward to your feedback when you get a chance. And Cindy shared this. I find students struggle more with patho than pharm. I would agree, because pharm is not all pathophysiology. It's just the mech of action. The rest of it, the dosage calc and other aspects of it. Cindy, great insight. But yes, the pathophysiology knowledge does lay that foundation and is so important. And I do agree, Nicole, with your insight. Man, if they don't have the answer, let's look it up together. You know what? We're all learners. You know what? As educators, we have not arrived. I've been a nurse for 36 years in practice. I'm still learning. I'm still looking things up. I'm still seeing things I haven't seen or remembered. So again, creating that curiosity, I think that's really important. I love the comments coming in. So thank you for putting those there, because what you're highlighting are some really important themes that we as educators, my heart is to share the knowledge that I've acquired, and just that all of you also have in varying degrees from your experience, but also to let's synergize and let's grow together and to strengthen our nursing education practice together. And so, yes, they can't know it all. And yeah, go on scavenger hunts and all that fun stuff. And so thank you so much for the chat. I'm going to move on because I want to finish by 9 o'clock and make this less than an hour so we get some really good information on lab values and fluids and electrolytes in closing. So what I want to kind of just talk about is we look at lab values and we look at labs. One of the questions that I would ask all of you is this: taking the same principle of pharmacology, taking the top 10 medications, let's identify top 5 labs in each semester, 3 to 5 labs that are most important to your clinical setting. But let's remember this: just because there's a lab panel, like a basic metabolic panel with 10 or 12 chemistries, they don't need to know them all. In fact, most of them, half of them are less than relevant most of the time to the nurse's scope of practice. But again, let's identify the top 5 labs and scaffold that as our students progress through the program, so that by the time they graduate, the most important lab values or the most important labs of a basic metabolic panel, a CBC, an LFT, the coags, the cardiac markers, etc., are identified so they know what's always relevant. One of the things that we need to help our students get away from, and I'm sure this is true in your program as well, just because a lab's abnormal doesn't mean it's relevant. And again, that's nuanced thinking that an expert nurse acquires in practice, that there are abnormal labs that aren't a big deal. And then there are those that even if they're normal, it's a big deal because of what they communicate and what they represent. And so let's make this real practical here. So I'm going to ask a question of y'all. Basic metabolic panel. You're all nurses. You know a basic metabolic panel, BMP. We got sodium, potassium, chloride, CO2, glucose, BUN, creat, GFR, BUN creatinine ratio, and finally the anion gap. That's going to be in the medical record. Your students who are novice nurses see everything as equally important, though they're not. So I want to have you guys put in the chat which one of those labs. There's about 4 out of those 10 to 12 that are always relevant to the nurse and to providing patient care, to interpret these labs by understanding what they're doing with their clinical significance. So let's identify relevance. We need to help our students sift through the medical record. Lab values is where they get bogged down. Let's help them right now. using your lens of practice, because you also don't look at every lab as equally relevant. Let's help our students focus. And so as we look at a basic metabolic panel, for example, one of the most common chemistries panels ordered. What are your thoughts about that? So I'm going to put the chat here open, and I'm going to get a little sip of water here. Just a moment. Thank you. Yeah, Jenna says potassium, sodium, BU, and creat. Potassium and sodium for sure. That's right. That's a good. You're safe with those, Nicole. Sodium, potassium, chloride, calcium, or calcium and magnesium. Magnesium is not on a basic metabolic panel. That is usually a separate panel. But you guys are all on the right track. You're awesome. And what I would say is always relevant is number one, sodium. Question is why? Well, sodium to me is like the fluid balance electrolyte. It's kind of like if your fluid balance is too high or too low, your sodium is going to be dilutional or possibly is going to be concentrated. That's a very general, very primitive, but sodium to me is always kind of like a fluid balance electrolyte. Potassium, we know its relevance to heart health and to heart electrical conduction. Either high or low, it's going to be a problem, especially if it's too high or too low. So that's my second lab that's always relevant, even if it's normal. Third is glucose. And again, glucose is needed for every cell's energy. If that's too high or too low, we got problems, especially if it's too low, as well as too high with diabetes. And finally, creatinine. BUN is a close second, but when you look at kidney function, what are we really looking? What's the gold standard? What's the most accurate reflection of renal function? BUN is variable on a number of different ways. Usually mirrors kidney function if it's high, if it's good or bad. But creat really is the most accurate reflection of kidney function. So that's my top four that are always relevant as it relates to a basic metabolic panel. Anyway, I would agree, Nicole. GFR also, again, more accurate, would also be a part of that. So again, I'm not saying that this is like the gospel. I'm just saying this is basically, use your lens of practice and teach practice, because that's what your students need to be safe in practice. And if we emphasize practice first and best practices of how we teach nursing, they'll be fine with next gen. Thank you very much. They're going to be okay. So let's again focus on practice. Let's do one more. CBC. CBC is also TMI. We've got a hemoglobin, white count, MCV, platelets, neutrophils, lymphs, monos, eosinophils, basophils, and bands. What are the 3 to 5? Excuse me, that are always relevant. Let me get another sip of water while you guys all think on that, and I'll be right with you. And so let's see what's coming up in the chat. I agree. Megan says white count, hemoglobin, and platelets. Great. And I totally agree, Megan. What I would add to that are in our differential, the neutrophil percentage and even the bands. Because if that's been tested, the neutrophils are the first responders to a bacterial infection, usually 6 hours. And so if a patient has an elevated white count, we want to look at their, excuse me, their neutrophil count. And if they've got band cells that are also elevated, that's a bad marker for sepsis. And so we want to be aware of that and put that together. And so great information. I totally agree. And so again, my question to you as educators, are we teaching our students this knowledge? Are we helping them to kind of funnel the content of clinical practice to practice? That again, you don't need to focus on everything. And so tell me if we're doing that in your programs. And Kim talks about the importance of OB. And I agree, the H&H and platelets, hemoglobin, hematocrit, and platelets. So thank you for sharing that, Kim. But as we look at fluids and electrolytes. One of the things that I think that our students struggle with, I know that mine did, is basically we have to help our students take the knowledge of lab values, really simple. We want to help our students, kind of like with pharmacology, know what the normal ranges are of the most important labs. Not every lab, but they should know the range of a normal creat and potassium, so that when they see that number, even without looking at the norms, they recognize the problem of either too high or too low. But our students also need to know, kind of applying the pathophysiology to lab values by understanding, like, what is the clinical significance of a creatinine? Why is it important? It's kind of like the why. Ask your students the why of their lab values. So why is a creatinine important? What's it measuring? Why is a potassium important? What's it measuring? Etc. So again, helping them to not only know the clinical significance, but also know the red flags. Just because it's abnormal by 1 or 2/10 of a point, usually isn't that concerning. If it's more than that, depending on the lab value, we have a problem. But then there's red flag data. And so again, we want to reinforce the problem recognition of red flags. So for example, if that neutrophil count is over 90%, if that white count is over 15 or 18 or 20,000, what does that mean? There's red flags, and our lab handbooks do identify that. For those labs that are most important, let's identify that and make that visible to our students. The final principle we need to do with our labs to help our students strengthen practice readiness is understand kind of a principle I call lab planning. Lab planning is this thinking skill that a nurse in practice uses to create a plan of care when a relevant abnormal lab is present. So for example, let's say that creatinine went from 1.2 to 2 with that heart failure exacerbation. Lab planning is an important skill we have to help our students do by helping them connect a relevant lab, what it means, and what does the nurse now do as it relates to relevant assessments and interventions. It's like creating a plan of care with an abnormal lab. So if that creatinine is too high, we don't just use NANDA. In fact, we focus on looking at that INOs, daily weights, fluid status, edema assessment, looking at all those nuanced aspects to help our students connect the lab that's relevant and abnormal and connecting that to, what a nurse does with it, because that's the gap. I have the knowledge, but what do I do with it in practice? And so as educators, especially in clinical, and again, using case studies, you can also bring this into your classroom and have a lot of fun with it, being that guide on the side as well. And so again, let me just kind of look and see what kind of questions I have in the chat here. And so I'm going to throw out some great comments here. Nicole, you are just a busy girl out there tonight. We have to close this gap between theory and practice. I tell my students clinical practice, it's bringing theory to life. And Nicole, that's why a good case study, that's why your stories that you bring, that's what it's all about. The NCLEX will take care of itself if we put practice first. Take my word on that. We can take that to the bank, especially educational best practice combined with practice of nursing. We can do this. And so, yes, absolutely. I love that. I love that insight, Nicole. And you know what? I want every one of you to really be blessed and to really, again, kind of put that together. This educator says, my program doesn't help bridge that gap. They assume that via reading the textbook and from clinical, all the pieces will suddenly click. It all makes sense. And, that's a deception. We really can't, just because you taught it, just because you covered it in a PowerPoint slide, doesn't mean your students will connect it and apply it to practice. We've got to help them. We've got to connect it and guide them in that knowledge acquisition. So thank you for sharing that. And Nicole also says, I have lots of stories as an ER and radiology nurse. Well, Nicole, we should talk sometimes. I think we both could have a few stories to share. But what I want to share in closing this section here is just kind of looking at lab values and some of the things that I share in the book, and some of the application activities that are available for educators as well as your students. And so I just want to share just a couple of just key pieces here with this and kind of show you what I have here, because what I've done with this book, with the pharmacology content, I'm just going to scroll to the section I wanted to talk about, is that, when you look at just some of the sodium, like for example, the sodium being too high or too low, just helping our students recognize what are some assessment findings of a too high, a too low, the common causes, as well as the implications, the volume aspect, the electrolytes, and what that looks like. And so again, I kind of take all of the electrolytes and put that there for them. But the most important lab values, I also kind of take each panel, and I had just some things that we just talked about. I would have given you the answers too quickly, so I didn't use the book. But again, here's the BMP, and again, helping students see some key takeaways. Just because of, some lab values are relevant, even if normal. And again, that's an important takeaway for students. And so identify kind of the physiologic significance of each lab value that's relevant in a basic metabolic, taking some of the best out there, the normal ranges. So again, just kind of helping students simplify fluids and electrolytes. Take the CBC, the same thing. What's relevant, what's there, and why it's relevant. And so again, helping students kind of connect this knowledge to practice. Though you can teach this, I spent a lot of time to put this together for you, and I think you'll find it a very valuable resource, not only for you as an educator, if you're a clinical instructor, but also consider it as a resource for your students. But what I wanted to show at the very end here is basically this lab planning, this principle of lab planning. Because what I want to help, here's a very simple chart where you have each lab that's always relevant in a basic metabolic. What is the red flag range? What is the physiologic significance? What does the sodium do? What does the potassium do? And then what are the nursing assessments if it's abnormal? And so again, connecting knowledge to practice. That's what we must kind of keep that always. We've got to bring that connection as educators. And so really when it comes to some of these activities, these are just my best efforts to, again, take these lab values, the knowledge, and then connect it to practice with specific assessments. And again, have the students work through and do these activities. And so kind of here's another way of looking at that in a linear range with the lab value. And I have a blank activity worksheet in the appendix, the normal range, the critical red flag, the significance, and the interventions assessment. And so I've been talking about this as I've traveled across the country as well, helping educators put that all together. And so, yeah, that's chapter 5 with lab planning. And so I just wanted to kind of just share and just want to know, what questions do you all have about lab values and the pharmacology and how we can connect it to practice? Is there any kind of loose ends that I didn't address, or any questions that you have, or more importantly, any comments that you have found successful to teach and to share these things in your practice? I'd love to hear it. So if you're, stay with me here in the last few minutes, and if you have some questions or thoughts, I'd love you to throw it out there and what that would look like. But, as we look at preparing our students for practice, this is really what I've learned in my journey. I'm going to share a concept called holistic clinical judgment. And, sometimes we get lost in the weeds of focusing on clinical judgment skills, the 6 steps of next gen, recognize cues, analyzing cues, generate hypotheses, and go down the line. And we, think like a nurse. But, to develop clinical judgment, there are 3 components that are needed, just like with a good nurse provides holistic care for the patient by caring for the physical, the emotional, and the spiritual needs. When it comes to clinical judgment, there are 3 components and comportments that we need to make visible to our students to really develop holistic clinical decision making. The first one is building the caring, the compassion, the importance of professional identity formation and behaving like a professional. That's why I made that the foundation of volume one, laying the foundation for professional practice, right? Talk about these in a very simple way, as well as student success in volume one. It's only about 180 pages, about 6 chapters. It's easy. I wouldn't say easy, but it's easy to read. It's not a textbook. It's more of a mentor with a lot of visuals, a lot of icons. That's step one. We have to develop the caring, because when you are not connected to the caring and engagement of the patient, they don't matter to you. That influences what you notice and what you assess and what you interpret. And that's a problem. The second aspect we need to emphasize is understanding essential knowledge. And that's why I wrote volume two, is building the knowledge for professional practice. And what this volume emphasizes, the applied sciences. What's most important of pathophysiology, pharmacology, fluids and electrolytes, a practice-based physical assessment that we talked about 2 weeks ago. They have to understand the knowledge, not just memorize it and pass the next test. The third component is clinical reasoning. Dr. Benner talked about that in educating nurses, but in essence, looking at the trusses that tie it together. And the volume three is all about the clinical judgment skills needed for professional practice. I use Tanner's framework as a practice-based model of clinical judgment with nursing process to help students connect and put that together, to use those noticing skills. What do you interpret? What are the problem recognition skills, planning skills, as well as then evaluative reflecting skills, putting it all together. And so this is a really unique volume that really will help any educator really understand and apply this knowledge to practice. And so, I really am not making this available to students at this time. I'm not really promoting it to students. My audience is primarily nurse educators. I want to empower you with the tools that can help you get a, kind of address, where your strengths are, where your weaknesses may be. And again, I have 2 resources there. One is the link to learn more about the book series, as well as a curriculum integration map. If you'd like to take the next step, consider adopting this in the fall or in the future for your students. It kind of complements the curriculum. It's not, I provide a practice-based knowledge that's embedded in practice, so your students can see why textbook knowledge is needed. So they kind of come next to each other. They're both needed. Like Dr. Benner shared in that article and what I highlighted at the beginning of this presentation, you've got to have that knowledge embedded in practice with the textbook knowledge. And as I looked at what I did, that's really what I did with this 3-book series without even really realizing it. And so I just want you to take a look at that and consider that resource. And just would like to know if any of you have further questions as you look at just what I've shared tonight, as well as relating to the textbook. I also want you to know I got a new blog coming out tomorrow. Actually, it's on my website right now. It's called How to Communicate the Knowledge from Practice to Develop Holistic Clinical Judgment. Kind of taking the things I've talked about today and just putting it in writing with some other resources. And so again, it's a resource for you to put that all together. And I hope you find it helpful. I want you to know that I'm always available to you as an educator, and so I just want you to just throw my email on the screen. Just email me at keith@keithrn.com if you have questions, comments, or just struggles that you might have in nursing education. I want you to know that I'm available, and want to encourage you to reach out. But I also have an educator group on the admin for. It's called Teachers Transforming Nursing Education. If you just were to go to Facebook, if you're not a member currently, it's got over 11,000 nurse educators from the United States, Canada, around the world that are just available to post a question, answer whatever is going on in your world. I mean, it's just an incredible community of educators who share their knowledge, their tools, their resources. I'm just so proud of this group. And if you're not a part of that community, it's a closed Facebook group. Again, I encourage you to check it out and get the support that you need to be part of the needed change, because again, we can't do change alone and can't do it together. And I agree, Diane, it is the best group ever. I hope you find it helpful. I'm so glad you're a part of it. And again, all that you're doing there. And so anyways, I just want you to, Heidi kind of made a comment that she looks forward to getting my books, and basically your husband met my dad on the golf course in Becker. So you're a Minnesotan, Heidi. So glad to have you there. And Susan, thank you for the kind words. Again, my goal is just to support you as educators. I'm available to you anytime by email. And it's my pleasure to come to you here on Thursday evenings and just to share the things that I've been working on in my ivory tower here in Minnesota. And it truly is my pleasure to serve your needs. I'll be back in 2 weeks, and in that week we're going to go deep into volume 3, developing clinical judgment for professional practice. We're going to talk about some of those different skills of clinical judgment. When you look at clinical judgment, it's complicated. And it's really more complex than I think, because we as nurses, we acquire knowledge from practice. We've got to remember, we've got to deconstruct it and break it down step by step by step. And it's bigger than just the 6 steps of the NCSBN model or even Tanner's framework. We've got to identify like the noticing skills. We'll start with and talk about those in 2 weeks from today. What are noticing skills? What are the questions we can ask? What are those noticing skills? There's about 4 of them that we need to specifically make visible to our students. So we'll talk about that. And I also just want you to know that this textbook series is at a pre-publication discount that will never be this cheap again. It's got free shipping as well for the next week. So again, if you're remotely interested, I would encourage you to check it out. I don't think you'll be sorry. And again, it's my pleasure to come to you here from my home office here in Minnesota. And thank you for spending this time with me tonight. And I look forward to connecting with you in 2 weeks. Have a blessed spring and finish the semester strong. Take care.